Hello guys, welcome to BM's Online Institute. My name is Dr. Maxwell Nvani, and today we'll be talking about the scapula. But before we dive into that, remember to like, comment, and follow our social media handles as well as subscribe to our YouTube channel. And for today, like I said, we'll be talking about the scapula, which is a bone found in the upper limb. Remember, we are dealing on a series, osteology of the upper limbs, and the last lecture we spoke about the clavicle. So today we'll be talking about the scapula. So I'm going to share my whiteboard. So just a minute. Now, we'll be talking about the scapula under the following outline. And I made a little modification compared to the outline for the clavicle. Okay, so in the clavicle, after introduction, the next thing was site determination. But this time around, from now henceforth, any bone we're talking about, we'll start with introduction, then features, before we go to the site determination, attachments, and clinical anatomy. Okay, so by way of introduction, the scapula is a thin bone located at the posterolateral aspect, right, of the thoracic cage, the posterolateral aspect of the thoracic cage. So, okay, it's up and running. Now, that is by way of introduction. Okay, so we're done with introduction, right? Now, features. Now, if you're describing the scapula, you describe the scapula under four major headings, right? We have surfaces, right? We have angles, processes, all right? And then we also have borders. So the scapula has two surfaces, three processes, three angles, and three borders. So we'll start with surfaces. Now, don't mind my diagrams. I'm not so good with diagrams, but if you draw something like this for your exams, I can bet you that you would get the required mark. So there are two surfaces, right? The anterior surface and the posterior surface of the scapula. Now, this first diagram where my cursor is showing the anterior surface, while this is showing the posterior surface, okay? So the anterior surface or the subscapular fossa, right, is located anteriorly and it embraces the thoracic cage, okay? So just imagine the scapula right here. So it touches or it embraces the thoracic cage, the rib cage, all right? So the dorsal aspect, however, the dorsal surface is divided into two fossas by this spine here, the spinous process. The upper fossa is called the supraspinous fossa, and the one below, the larger one below, is the infraspinous fossa. All right. So we're done with surfaces. Now, I said surfaces, the next borders. It has three borders, okay? It has the medial border, it has the superior border, and it has the lateral border, which is very thick, okay? It's very thick. Now, it has, now just before we go to angles, the superior border, just medial to the coracoid process. This is a coracoid process. This is a coracoid process, the finger-like projection on the anterior aspect of the scapula. So just lateral to it, sorry, just medial to it, we have a depression there called the suprascapular notch. And there is a ligament that runs across this notch called the transverse ligament, all right? And we have vessels passing above the suprascapular vein and artery passing above the transverse ligament, while the suprascapular nerve passing through or deep to this transverse ligament, okay? So yeah, we're done with borders. Now let's talk about the angles. We have three angles, like I said, the superior angle right here. We have the inferior angle right here. And then we have the lateral angle which bears the glenoid cavity. The glenoid cavity is meant for articulation with the head of the humerus. Okay, good. So we're done with angles, borders, and surfaces. Then finally, we have processes. The scapula has three processes. We have the coracoid process here, which is a finger-like projection directed laterally and forwards. Okay, it's more or less going laterally and forwards, not necessarily forwards alone. So it's projected to go laterally also. Okay, then we have the spinous process. You look at this diagram that is depicting the posterior aspect of the scapula. We have the spinous process that continues as the acromial process. Okay, so we have the acromial process, the spinous process, and the coracoid process. So now I'm going to share my screen so that we can have the 3D representation of what we are talking about. So share my screen now, so just a minute. All right. Okay. I believe you can see my screen now. So I'm going to, all right, we're good to go. So now this is the osteology of the upper limb. This is your hand from the wrist downwards. It's your hand from the wrist to your elbow, your forearm, from the elbow all the way to the shoulder is your arm. We have the clavicle right here. Okay, this is anatomical position. Okay, the bones in anatomical position. And then this is the scapula right here. Good. So now let's isolate the scapula and we'll talk about the scapula now. Just as a recap of what we've talked about already. I said it has two surfaces, right? It has the anterior surface, which bears the subscapular fossa right here. You can see that, right? And then the posterior surface, which is convex posteriorly and is divided into two. This upper smaller portion called the supraspinous fossa, and the lower larger portion of the posterior aspects called the infraspinous fossa. So what divides these surface into two is the spinous process, what you're seeing here, this projection you're seeing here. And I said the spinous process is continuous as the acromion. Okay, so you can see the orientation of the spinous process has the upper surface, and it also has the lower surface. Okay, now this portion of the spinous process is called the crest of the spinous process, and it has the upper lip where my cursor is, and it also has the lower lip right here. Okay, now the upper lip is continuous with the medial border of the acromion right there, while the lower lip is continuous with the lateral border of the acromion. So the acromion on its own, you can see the way it's oriented, curves. It has a facet for the articulation of the clavicle to form the acromioclavicular joint. It has two surfaces, the superior surface and the inferior surface. It has two borders, got the orientation, medial border, and of course, lateral border. All right. So that is the spinous process. Now, this portion here is referred to as the root of the spine or the spinous process. Okay, like the origin. Okay, so this is the root of the spinous process, supraspinous fossa, the whole of this. Now, there is a connection between the supraspinous fossa and the infraspinous fossa. This connection here is called, got it right here, is called the supraglenoid notch. All right. So the suprascapular vessels, they pass through that notch all the way to the infraspinous fossa. Now, I told you that the lateral border is very thick. You can look at it, you can appreciate it. It's very thick. This is the superior border up here. And just lateral to the root of the coracoid process, we have this suprascapular notch that I talked about, and that is bridged by the transverse ligaments, right? This is your medial border. This is inferior angle, superior angle, lateral angle that bears the glenoid cavity for the articulation of the head, the humerus. Now, just you can see this elevation right here, just beneath the glenoid cavity. Now, this is the infraglenoid tubercle, while just above it, we have the supraglenoid tubercle, okay? So we've talked about borders, we've talked about surfaces, we've talked about angles. Now, finally, let's talk about processes. We spoke about the spinous process and the acromion. The last is the coracoid process. You can see the way it's oriented. It's forwards and laterally, okay? This is the tip of the coracoid process right here. This is a tip, and it has the medial border here and the superior surface here. You can see the superior surface, right? Okay, so this is the gross anatomy of the scapula. So now let's talk about attachments quickly. I'm going to use this. All right, so that you guys can appreciate attachments, muscular attachments. Now, we'll start from the first. The triceps brachii, the long head of the triceps brachii. This is the triceps brachii muscle, highlighted. Now, the long head attaches along or at the infraglenoid tubercle. Okay, then we have the teres major muscle at the lower 1/3 along the lateral border on the dorsal aspect of the scapula. Okay, that's the teres minor. Sorry, teres minor, the upper 2/3. Okay, while the teres major right here is in the lower 1/3. So upper 2/3, the teres minor attaches along the lateral border on the dorsal aspect of the scapula, while the teres major attaches along the lower 1/3 of the lateral border on the dorsal aspect of the scapula. All right, so we have the infraspinatus muscle in the infraspinal fossa, and then we also have the supraspinatus muscle attaching in the supraspinous fossa, okay? We're not talking about muscles today, so I will talk about where they are going to. I just want you to have a mental picture of how this thing looks like in the cadaver. Now, we have the biceps brachii, right? This is your biceps brachii muscle of the arm right here. Now, it has short head and long head. Now, the short head, where my cursor is, goes all the way to the tip of the coracoid process alongside the coracobrachialis muscle. So there are two muscles that are attached at the tip of the coracoid process. Come out in your practical, your viva, will be shaded, and we ask you attachment or what is attached there. It's the coracobrachialis and the short head of the biceps brachia, while the long head goes to the supraglenoid tubercle. Look at the long head here. Okay, passes through the intertubercular sulcus of the humerus and goes all the way to the supraglenoid tubercle of the scapula. Okay, supraglenoid tubercle of the scapula. Now, in the subscapular fossa, we have the subscapularis that is found there, is attached there. And along the medial border, still on the anterior aspect, we have the serratus anterior. Very important. As a matter of fact, it's the reason why we study, one of the reasons why we study the scapula, okay? So, like as per clinical, so the serratus anterior muscle attached just along the medial border all the way to the inferior angle, but on the anterior aspect, the anterior surface. Now, on the posterior surface, along the same medial border, but on the dorsal posterior aspect, all the way from the superior angle to the root of the spine, we have levator scapulae. While at the root of the spine, we have rhomboid minor, and then from the root of the spine all the way down to the inferior angle, we have rhomboids major. And then at the inferior angle itself, we have the latissimus dorsi. Those muscles I just called are not represented here because they do not originate from the scapula. Okay, so we have the latissimus dorsi just at the inferior angle. Now, your spinous process along the lower lip of the spinous process, of the crest of the spinous process, alongside the lateral border of the acromion, we have the deltoid arising there. And then we also have trapezius muscle on the upper lip alongside the medial border of the acromion. We have trapezius muscle inserting there. Okay, so let me show you the deltoid muscle. You can see this large multipennate muscle right here. Okay, you can see its orientation, its origin. I said the lower lip all the way to the lateral border of the acromion, all the way to the anterior border of the clavicle. It goes down to insert at the deltoid tubercle of the humerus. All right, so that is attachment. So now let's go back to our whiteboard. Okay, so from the outline, we've talked about introduction, we've talked about features, we've talked about clinical attachments. Now, site determination. Now, like I said before last week, I told you that when you're talking about site determination, you're trying to identify which side that bone is. Is it the left scapula or the right scapula? And to do that, you use this concept, differentiating the medial aspect from the lateral aspect, the superior from the inferior, and the anterior aspect from the posterior aspect. So if they give you the scapula, okay, if you want to know whether it's the left or the right, the first thing first is you differentiate in any order, whether it's superior from inferior, medial from lateral, anywhere you're starting from, there's no problem. So let's pick medial from lateral. How do you differentiate the medial aspect of the scapula from the lateral aspect? The lateral aspect has the glenoid cavity, and the border is very thick. Okay, so once you see the glenoid cavity, you position it or you orient it to face laterally. Okay, now how do you differentiate superior from inferior? Now, if you check the outline of the scapula, just follow my, let me get my cursor. Okay, so if you look at this outline, it's triangular, right? with the apex oriented downwards. So once you pick the scapular bone and you find this apex, and that is the inferior angle, you are to orient it facing inferiorly. There is no time that this bone is placed upwards with the apex of the inferior angle facing upwards. I mean, that's the reason why it's called inferior angle, okay? So how do you differentiate anterior surface from the posterior surface? The anterior surface, as a subscapular fossa, has no spine. The posterior surface has the spine. That's where the spinous process is located. So once you pick that bone, you see the spinous process. It should be facing posteriorly. The glenoid cavity should be facing laterally, while the inferior angle should be facing inferiorly. Once you do that, you will tell whether that bone is the left or the right. If it fits to the right, then it's the right. If it fits to the left, then it's the left scapula, okay? So that's site determination. Now, this diagram here is something they could bring for you. I purposely didn't label it. I mean, they could keep the scapula and they just paint here. I told you it's the serratus anterior. They could paint right here. That's the subscapularis. They could paint here. That is the supraglenoid tubercle. What's attached there? I told you the long head of the biceps brachii, while the infraglenoid tubercle, I told you the long head of the triceps brachii, etc., etc. So you could pause at this point and just try to see how you could label this diagram, because it could come out, it could keep the bone for you and paint anywhere for you to identify. And then the B portion is what attaches there, okay? Now, lest I forget, the coracoid process, there's an important ligament there. There are other ligaments that are attached there, but I don't want to dive down there. But there's just one I should mention: the coracoclavicular ligament, rather. Coracoclavicular, from the coracoid process, okay? From the coracoid process upwards to the clavicle. Remember, the clavicle is just above that portion, articulating with the acromion, okay? So that's, if this is your coracoid process, this is your acromion. The ligament is found from this coracoid process all the way to the clavicle. That's your coracoclavicular ligament. Remember, on the clavicle, it's attached to the conoid tubercle and trapezoid ridge. It's important because they usually mark that portion and tell you to identify it and say what attaches there. Okay, so as we're done with attachments, now let's talk about, we're done with introduction, we're done with features, site determination, attachments. Now the last is clinical anatomy. Now, the most prominent clinical anatomy is winging of the scapula, which is undue prominence of the medial border of the scapula as a result of damage to the nerve supplying serratus anterior. Remember, this is your serratus anterior right here. So you can see that it holds the medial border to the rib cage and helps for overhead abduction of the arm. So if that muscle is paralyzed, if a patient places his hands like this on the wall, you would appreciate the medial border of the scapula, which is not supposed to be so. So that is winging of the scapula. Look at the diagram right here. You can see this undue prominence right here, undue prominence. Okay. So it's as a result of damage to the nerve supplying the serratus anterior muscle. And that nerve is the long thoracic nerve of Bell. All right. So thank you guys. I hope you enjoyed the lecture. Remember to like, comment, and subscribe to our YouTube channel, BM Online Institute. And if you're interested in online tutorials through a virtual classroom, do well to reach us through the number on the description box of this video. All right. And also our social media handles on Instagram and Facebook remains BM's Online Institute. Do well to like, follow, and of course, reach out to us anytime, any day. Thank you, and do enjoy the rest of the day.